Hi, my name is Caitlin Cosby. I am a second year medical student at Oklahoma State University College of Osteopathic Medicine at the Cherokee Nation. And today I'm going to be presenting to you a cultural pathway to osteopathic medical school, the Native American pre-admissions workshop. So to get started, Native Americans experience significant health disparities compared to the general US population. We know this from multiple articles, but also just being Native American ourselves. We see it in our families and know that the cultural aspect sometimes is a barrier to healthcare. Underrepresentation begins in the medical education pathway, with only 0.3% of residents and merely 0.15% of faculty serving the 2.9% of identifying Native Americans. There is a void in literature specific to the recruitment, training, and development of Native American providers in the U.S. workforce. This likely contributes to the limited success of U.S. medical schools to train Native American physicians. And that is one of the main goals of not only what I'm presenting to you today, but also just our philosophy here at OSU Cherokee Nation. So our objectives, the primary objective of this project was to increase the awareness of osteopathic medicine, including introduction of osteopathic practice and philosophy among Native Americans interested in pursuing a career in medicine. Our secondary objective was to provide prospective Native American applicants exposure to the knowledge, skills, behaviors, and attitudes necessary for successful matriculation to osteopathic medical school. So how the NAPA workshop works is, first of all, we would have loved for it to be in person, but unfortunately with COVID, we had to do this virtual. But I think that gave us an advantage because we got to do it nationwide participation, and it wasn't restricted to people who could actually travel to Tahlequah for the event. So some of the things that we did, our initial presentation was just kind of about our school and the cultural aspect of our campus specifically, and honestly, how much we just love it here. One of the other things that we did was we taught about the osteopathic manipulative medicine course here. And so we did a demonstration about some of the techniques, and we kind of presented them a case and talked about why we do this and how it helps patients in a holistic way. One of the other things that we did, again, unfortunately, because we were on Zoom, we had a pre-recorded clinical skills simulation. And so the people that participated in this project, we went and recorded a simulation and we presented it to them on Zoom. And so it was a code in our simulation center, and we kind of got to show them around, show them what was in the center and kind of some of the skills that we have learned as second-year medical students. One of my personally favorite parts about this whole conference is just giving them the student perspective. I think that's one of the most important things that a student can gain is a perspective from another medical student about what they're going through, how they can do it, you know, some of the challenges, but how we've been able to overcome it, and just the family atmosphere here at OSU. And one of the most important things for them was to know about the actual process of getting into medical school. So the admissions, all of the things that have to do with the application. And one of the really cool things that we were able to give them was an interviewing opportunity with faculty members that actually do interviews on interview day. And so we had them in breakout rooms, and everyone was able to answer some questions as it would be on interview day. And I think that's really special. Not a lot of people, I think of what kind of questions they're going to get on interview day. And so that was really cool for them to be able to have those interviewing skills. So after the conference was all said and done, the inaugural one, which was in the spring of 2021, 56% of them, when surveyed, said that they plan to apply within a year of when this conference occurred. 33% of them within the next 2 to 3 years, 7% of them were unsure, and 4% had already applied. So in total, we've had 41 students attend both conferences. We had a little more in the spring and a little less this fall, with 27, and 14. 9 of them completed applications out of all of the groups. 1 completed an application for the 2020-2021 cycle, and we had 8 complete an application for the 2021-2022 cycle. And really exciting, we've actually had 2 of those students accepted in the 2021-2022 cycle. So we're really proud of them, and I think that shows us that we are only growing. So the NAPA workshop participants gained exposure to the Native American healthcare leaders and cultural integration of medicine. Prospective students learned how to apply the osteopathic medical school and transition into being students themselves while receiving insight into a future career as Native American physician. So they were able to see not only how our school works and how medicine works, but also specifically the osteopathic principles and insight as to what a future career is and what it looks like as a student. The NAPA Workshop is an innovative program led by Native American medical students. We created this conference, therefore implementing an intervention with the Native American community itself to increase outreach, education, and mentorship for increased Native American enrollment in medical school. This project built upon the osteopathic practice and principle that the body is capable of self-regulation, self-healing, and health maintenance on the population level by providing interventions to heal the lack of physicians serving in the Native American community from within the community itself. So in conclusion, the Native American Students of Osteopathic Medicine, which is the NASOM club here, created the NAPA workshop to build off of the existing pathway programs OSUCOM has to offer that focus on underrepresented groups. So some programs that already exist are the Native Explorers, the Minority Association of Pre-Medical Students Conference, aka the MAPS Conference, and Operation Orange. The student-led NAPA workshop has resulted in an additional culturally sensitive pathway for increased recruitment of Native American medical students, the most underrepresented group in medicine, furthering OSUCOM's mission to recruit, train, and retain physicians serving in rural and tribal communities. And that's really the main goal of this conference, is to give exposure to those Native American students that they can do this, and these are the opportunities that they have. Here are my references. And if you have any questions, feel free to contact me at my email listed below or my phone number. And the other people listed are some of the amazing people that I got to work with. And without them, none of this would have been possible. Thank you so much for your time.